Friedreich's ataxia is an neurodegenerative disorder. Look at this picture shows that disease mechanism and MRI brain findings. Look at this detail going on. Introduction. Friedreich's ataxia is a rare inherited neurodegenerative disorder that primarily affects the nervous system and the heart. It results in progressive damage to the spinal cord, peripheral nerves, and the cerebellum, leading to muscle weakness, loss of coordination, and other systemic complications. It commonly begins in childhood or adolescence and progresses over time, significantly affecting quality of life. A definition. Friedreich's ataxia is a autosomal recessive inherited disorder characterized by progressive ataxia, loss of coordination, muscle weakness, and often hypertrophic cardiomyopathy. It is caused by a mutation in the FXN gene leading to a deficiency of frataxin, a mitochondrial protein critical for iron metabolism and mitochondrial function. Etymology. The term Friedreich's ataxia is named after Nikolaus Friedrich, the German pathologist who first described the condition in the 1860s. The word ataxia comes from the Greek, a meaning without, and toxis, meaning order or coordination, referring to the loss of muscle coordination characteristic of the disease. Epidemiology. Friedreich's ataxia affects approximately 1 in 40,000 to 50,000 people, making it the most common inherited ataxia worldwide. It is more prevalent in individuals of European, Middle Eastern, and North African descent, with a carrier frequency of about 1 in 90 in these populations. Types. While Friedreich's ataxia is typically considered a single genetic disorder, variations exist based on one typical or classical Friedreich's ataxia onset before age 25. 2. Late onset Friedreich's ataxia, onset between age 25 to 40. 3. Very late onset Friedreich's ataxia, onset after age 40. 4. Atypical Friedreich's ataxia presents with non-classical symptoms or slower progression. Causes: genetic mutation most cause are caused by GAA trinucleotide upset, expansion in the FXN gene on chromosome 9. This expansion reduces the production of frataxin, a mitochondrial protein involved in iron sulfur cluster biogenesis. Risk factors: 1. Family history of Friedreich's ataxia. 2. Consanguinity. Parents related by blood increases the risk of in autosomal recessive conditions. 3. Carrier status. Both parents must carry one mutated FXN gene to pass the condition to their child. Complications: 1. Cardiomyopathy, enlarged heart or arrhythmias. 2. Diabetes mellitus. 3. Scoliosis. 4. Hearing and vision loss. 5. Loss of amputation. Many patients require a wheelchair within 10 to 15 years of onset. 6. Swallowing and speech difficulties. 7. Reduced life expectancy. Many individuals live into their 40s to 60s. Pathophysiology. Pathophysiology of Friedreich ataxia, step-by-step process. 1. Genetic mutation in FXN gene. Friedreich ataxia is caused by GAA trinucleotide repeat expansion in the FXN gene on chromosome 9. This mutation is autosomal recessive and leads to reduced expression of the frataxin protein. 2. Frataxin deficiency. It is a mitochondrial protein that helps regulate iron sulfur cluster formation and mitochondrial ion homeostasis. Low frataxin levels impair mitochondrial function, especially in neurons and cardiac muscle cells. 3. Mitochondrial ion accumulation. Without frataxin, ion accumulations in the mitochondria. This leads to increased production of reactive oxygen species and oxidative stress. For oxidative stress and mitochondrial damage, excess ROS cause damage to mitochondrial DNA, proteins, and lipids, leading to cellular dysfunction and apoptosis. High energy demand tissues link the dorsal root ganglia, spinocerebellar tracts, cerebellum, and heart are especially vulnerable. 5. Neurodegeneration, degeneration of dorsal root ganglia, loss of preoccupation and sensory input, spinocerebellar tract and corticospinal tract, ataxia, muscle weakness, and motor coordination loss, cerebellum, impaired balance and coordination. 6. Cardiac involvement, frataxin deficiency also affects cardiomyocytes, leading to mitochondrial dysfunctions, myocardial hypertrophy, and ultimately hypertrophic cardiomyopathy or arrhythmias. 7. Systemic manifestations. In some patients, mitochondrial dysfunction extends to pancreatic beta cells, contributing to diabetes mellitus, progressive skeletal deformities, example scoliosis, peace curves, occur due to muscular imbalance and nerve degeneration. This progressive chain of events underlines the multi-system symptoms and gradual decline seen in Friedreich's ataxia. Signs and symptoms. 1. Neuromuscular symptoms, progressive gait ataxia, muscle weakness, spasticity, dysarthria, loss of deep tendon reflexes, Barbaric sign. 2. Sensory impairments, loss of preoccupation, sense of body position, decreased vibration sensation. 3. Skeletal abnormalities, scoliosis, peace curves, high arched feet. 4. Cardiac symptoms, palpitations, chest pain, cardiomyopathy symptoms. 5. Other symptoms, fatigue, vision and hearing loss, diabetes mellitus, Diagnosis 1. Clinical evaluation. 2. Genetic testing to identify GAA repeat expansion in the FXN gene. 3. MRI of brain spinal cord to assess cerebellar and spinal atrophy. 4. Electromyography EMG to evaluate muscle and nerve function. 5. Echocardiogram EKG to detect cardiomyopathy or arrhythmias. 6. Blood glucose levels for diabetes screening. Nursing diagnosis 1. Impaired physical mobility related to progressive neuromuscular dysfunction. 2. Risk for impaired skin integrity due to immobility. 3. Imbalanced nutrition less than body requirements related to swallowing difficulties. 4. Disturbed body image related to progressive physical limitations. 5. Anxiety related to diagnosis and chronic nature of the condition. Medical management 1. No cure. Treatment is symptomatic and supportive. 2. Cardiac care. Use of beta blockers, ACE inhibitors. 3. Diabetes management. Insulin or oral hypoglycemics. 4. Speech and swallowing therapy. 5. Surgical interventions for scoliosis or foot deformities. Medications under research 1. Epidemiology antioxidant showing some benefit in cardiac symptoms. 2. Oxylone FDA approved in the US 2023 for FA improves mitochondrial function. 4. Gene therapy in clinical trials. Nursing management 1. Assist with amputation and mobility aids. 2. Prevent falls and pressure sores. 3. Monitor cardiac and respiratory status regularly. 4. Educate about medication adherence and symptom tracking. 5. Offer emotional support and coordinate multidisciplinary care. Treatment options 1. Physical therapy improves strength, flexibility and coordination. 2. Occupational therapy aids in activities of daily living. 3. Speech therapy for communication and swallowing difficulties. 4. Cardiac treatment based on cardiologist evaluation. 5. Pharmacological therapy, symptomatic treatment and antioxidants. Psychosocial medicine 1. Individual and family counseling to support emotional well-being and coping. 2. Support groups connect patients and families with shared experiences. 3. Educational support for school aged children with mobility or learning issues. 4. Vocational rehabilitation helps patients adapt to workplace needs. 5. Mindfulness and relaxation techniques reduces anxiety and enhances mental resilience, prevention. 1. Genetic counseling for at risk families or coupled with family history. 2. Carrier screening, especially in population with known FA prevalence. 3. Prenatal genetic testing in families known to carry the mutation. In conclusion, Friedreich's ataxia is a serious progressive neurodegenerative disorder with multi system involvement, particularly affecting the nervous and cardiovascular system. While there is currently no cure, early diagnosis, genetic counseling, and a multidisciplinary management approach can significantly improve the quality of life. Ongoing research and emerging treatments offer hope for slowing disease progression and potentially altering its course in the future.